Hello, everybody. I'm Dr. Unni Karunakara. I'm a member of the faculty at the Yale School of Public Health and visiting faculty at Tsinghua University in China, Yonsei University in South Korea, and Manipal University in India. I've been a humanitarian worker for many years, and from 2010 to 2013, I was international president of Médecins Sans Frontières. Smokers are one group of adults who are at particular risk if they catch a viral infection. Many smokers already present with poor respiratory health caused by years or even decades of smoking. A higher percentage of smokers compared to non smokers have health conditions like COPD, heart disease, and asthma, which are made worse by smoking and exacerbated by illness. For these smokers, catching a virus increases their risk of developing complications and is potentially fatal. This is because smoking worsens the respiratory system, causing breathing difficulties. Studies now suggest that smoking may be associated with adverse outcomes in COVID 19 patients. A study in China found that men were slightly more likely than women to be hospitalized for coronavirus infections. And scientists say this observation could be related to the fact that in China, vastly more men than women smoke. Another study, which has been published online in a Chinese medical journal, involved 78 patients with COVID 19 and found that those with a history of smoking were 14 times as likely to develop pneumonia. Lung specialists say that smoking increases inflammation in the lungs, making them less likely to respond appropriately when faced with a viral onslaught. Tiny fibers, called cilia, that remove dirt, dust, and germs are damaged by smoke, as are blood vessels important for oxygen distribution. Damage to the airway can also make it easier for bacteria to grow. Smoking is also a known risk factor for influenza. People who smoke are immunosuppressed to some degree. They make more mucus and it doesn't clear the lungs as well. There are also pro inflammatory changes. Immune cells change too. Smokers are therefore more likely to get viral infections and suffer worse outcomes. The sensible thing for people to do, of course, is to stop smoking, stop vaping, and avoid secondhand exposure. Based on what we know now about smoking and e cigarettes, and in particular about smoking and COVID 19, it stands to reason that quitting smoking will have beneficial effects. Thank you. Stay healthy.